Hi folks! Did you know that mental illness is now becoming an interesting and warm issue in the community, especially among young people? Actually, I have no clues about what types of mental illnesses are and what is mental illness itself until I consulted with a psychiatrist. I want you to know how mental illness can be a crucial thing when you realize that everyone around you may have a mental illness. I hope you will imagine what you feel and know what to do if your loved ones, friends, or your family have a mental illness. That's why I choose this topic to discuss. The 2018 Basic Health Research shows that more than 19 million people over the age of 15 experience mental and emotional disorders, and more than 12 million people over the age of 15 experience depression. The Director of Prevention and Control of Mental Health and Drug Problems in Indonesia, Dr. Celestinus Elgiamunter, explained that mental health problems in Indonesia are related to the problem of the high prevalence of people with mental disorders. Currently, Indonesia has a prevalence of people with mental disorders around 1 in 5 of the population, meaning that about 20% of the population in Indonesia has the potential for mental disorders. So now, we will talk about one type of mental illness, which is borderline personality disorder. But before we get to that point, what is mental illness? Mental illnesses are health conditions involving changes in emotion, thinking, or behavior, or a combination of these. Mental illnesses are associated with distress and or problems functioning in social, work, or family activities. There is some example of mental illness such as depression, anxiety disorder, schizophrenia, eating disorder, bipolar, and of course borderline personality disorder, and so on. Now let's move to our main point, borderline personality disorder. Borderline personality disorder, or we can call as BPD, is a problem of pervasive instability in many areas of functioning, which include managing emotions, controlling one's behaviors, relating to others, and building a sense of self. So, as you can see, it's a problem that has to do with all our areas of personality functioning. People with borderline personality disorder tend to have mood swings that are reactive to stress, and these mood swings will vacillate between depression, anxiety, anger, and sometimes feeling really quiet, nothing at all. The other problem of emotions that people with BPD may have is that they can get very angry to a point of being enraged. And this leads to inappropriate outbursts of anger and aggression that can become very problematic for relationships. Most people with BPD will have also a mood disorder, mostly depression or other anxiety disorders, including PTSD in some cases. In addition, people with BPD will commonly struggle with substance use problems, eating disorders, and problems with ADHD. There has been a lot of neurobiologic research into BPD in the past several years. When we look brain scan of individuals with BPD, we can see that the more emotional part of the brain, more of the area where the amygdala is, that part can be really overactive and easily triggered by situations with other people where they feel rejected. In contrast, the frontal part of the brain, the prefrontal cortex, which we really think of as more of like the brakes on the system, that part can be underactive in social settings. So you have an imbalance between the really intense emotional part of the brain and the more controlled frontal part of the brain. And when that imbalance is off, that's when we start to see the dysregulation and the concerning behaviors that can be characteristics of BPD, such as suicidal thinking and self-harm. People with borderline personality disorder may experience intense mood swings and feel uncertainty about how they see themselves. Their feelings for others can change quickly and swing from extreme closeness to extreme dislike. They may act impulsively or recklessly. Other signs or symptoms may include: first, efforts to avoid real or perceived abandonment, such as plunging headfirst into relationships or ending them just as quickly. Second, a pattern of intense and unstable relationships with family, friends, and loved ones. Third, a distorted and unstable self-image or sense of self. Fourth, impulsive and often dangerous behaviors such as spending sprees, unsafe sex, substance abuse, reckless driving, and binge eating. But if these behaviors happen mostly during times of elevated mood or energy, they may be symptoms of a mood disorder and not borderline personality disorder. Fifth, self-harming behavior such as cutting. 6. Requiring thought of suicidal behaviors or threats. 7. Intense and highly variable moods with episodes lasting from a few hours to a few days. 8. Chronic feelings of emptiness. 9. Inappropriate, intense anger or problem controlling anger. And the last, 10. Feelings of dissociation, such as feeling cut off from oneself, observing oneself from outside one's body, or feelings of unreality. Not everyone with borderline personality disorder may experience all of these symptoms. The severity, frequency, and duration of symptoms depend on the person and their illness. Researchers are not sure what causes borderline personality disorder, but studies suggest that genetic, environmental, and social factors may increase the risk of developing it. These factors may include family history. People who have a close family member, such as parent or sibling, with the illness may be at a higher risk of developing borderline personality disorder. And then, brain structure and function. Research shows that people with borderline personality disorder may have structural and functional changes in the brain, especially in the areas that control impulses and emotion regulation. However, the studies do not demonstrate whether these changes were risk factors for the illness or if such changes were caused by the disorder. Next is environmental, cultural, and social factors. Many people with BPD report experiencing traumatic life events such as abuse, abandonment, or hardship during childhood. Others may have been exposed to unstable, invalidating relationships or conflicts. Although these factors may increase a person's risk, it doesn't mean it is certain that they will develop BPD. Likewise, people without These risk factors may develop the disorder in their lifetime. A licensed mental health professional, such as a psychiatrist, psychologist, or clinical social worker, who is experienced in diagnosing and treating mental disorder, can diagnose BPD based on a true interview and a discussions about symptoms. A careful and true medical exam also can help rule out other possible causes of symptoms. In diagnosing the illness, providers will discuss a person's symptoms and ask about family medical histories, including histories of mental illness. BPD historically has been viewed as challenging to treat, but with newer evidence-based treatment, many people with this disorder experience fewer and less severe symptoms, improved functioning, and better quality of life. It is important for patients with BPD to receive treatment from a licensed mental health professional. Other types of treatment are treatment from a provider who is not appropriately trained, may be ineffective or dangerous. It is important for people with BPD and their loved ones to be patient and receive support during treatment. The treatment and therapies that can we do for BPD are: first, psychotherapy. Psychotherapy, sometimes called talk therapy, is the first-line treatment for people with borderline personality disorder. Most psychotherapy occurs with a licensed, trained mental health professional in one-on-one sessions or with other individuals in group settings. Group sessions may help teach people with BPD to interact with others and express themselves effectively. Two examples of psychotherapy used to treat BPD are: first, dialectical behavior therapy, or we can say it DBT. This treatment was developed specifically for individuals with BPD. DBT used concepts of mindfulness or awareness of one's present situation and emotional state. DBT also teaches skills to help people control intense emotions, reduce self-destructive behaviors, and improve relationships. Second is cognitive behavioral therapy, or we can say it as CBT. This treatment can help people identify and change core beliefs and behaviors that come from inaccurate perceptions of themselves and others and problems interacting with others. It may help people reduce mood swings and anxiety symptoms and may reduce the number of self-harming or suicidal behavior. Second treatment is medications. Because the benefits of prescription medication for BPD are unclear, medications are not typically used as the primary way to treat the illness. However, in some cases, a psychiatrist may recommend medication to treat specific symptoms or co-occurring mental disorders such as mood swings or depression. Treatment with medications may require coordinated care from more than one medical professional. Medications also can sometimes cause side effects in some people. Third is other elements of care. Some people with BPD experience severe symptoms and need intensive, often inpatient care. Others may use some outpatient treatments but never need hospitalization or emergency care. And fourth is therapy for caregivers and family members. Having a relative or loved one with the disorder can be stressful. and family members or caregivers may unintentionally act in ways that can worsen their loved one's symptoms. Although more research is needed to determine how well family therapy helps with BPD. Studies on other mental disorders show that including family members can help support a person's treatment. Families and caregivers also can benefit from therapy. Here is the diagram of treatment for mental illness. As we can see, support group is the highest score of treatment for someone who has mental illness. So it is important for us to always support everyone around us that have a mental illness. Folks, if you need someone for sharing, just tell me privately. Let me know how's your day. But if you need some counseling, come to psychologist or psychiatrist. It's okay if you go there. You will get better. Have a very good day. See ya!